Let's bring in CANSA's Head of Health, Professor Michael Herbst, as we look at Cancer Awareness Month marked in October in South Africa. Very good afternoon to you, Prof. Michael, and thank you for your time with us here on the SABC.
Thank you very much for having me this afternoon. We've got a blackout, so if the pictures aren't all that clear, please bear with us.
It's a problem that we're obviously experiencing nationwide, Prof. Let's see how far we can get into the conversation. Thank you for your time with us. At this point, given the statistics emerging, the prevalence as well in South Africa, help us paint that picture and understand really the reality on the ground.
Yes, you know, if we want to look at the number of people diagnosed with cancer, we have the latest statistics, and those are for 2019. And according to that, we must remember that only people whose cancer was confirmed by means of a pathology report, only they are taken up into the registry. But in 2019, 235 people were diagnosed with cancer every day. And that tells us it's quite something. And then, of course, if we want to look at the top cancers for males and females, females' breast cancer, of course, the number one cancer for women worldwide. And nearly 120 women are diagnosed every day. For men, prostate cancer will be the cancer number one, and about 115 men are diagnosed every day with prostate cancer. These are the ones we know about. The ones who live in the rural areas, who've got really not sufficient access, they're not in the picture at all.
Prof, we'll get into some of those inequalities and inequities. At this point, I wonder if you could speak to what the impact of lifestyle choices has on the data emerging, perhaps also stress factors. Has there been an advancement or improvement in treatment as well and diagnosis as we look at ways to reduce some of these risk factors?
Great, yes, you know, cancer doesn't ask any questions. Whether you're rich or poor, whether you're white or black or bicolored or whatever the case may be, cancer affects every single race and every population group, and male and females alike. But there are things that we can do, not to prevent cancer, but to reduce our risk. And that is to live a healthy lifestyle. And I think not necessarily in a specific order, but the important things is, do not smoke. Remember that smoking is not only linked to lung cancer, it is directly linked to 12 other cancers as well. Do not use alcohol. Alcohol is linked to about 15 different cancers. There is no safe level of alcohol consumption. We must be as active as possible. And this is why we celebrate Cancer Days with walks, to show activity, because insufficient activity, not only as far as cancer is concerned, but our general health is concerned, very, very important to be as active as we possibly can be. Then to eat a well-nourished diet. Now, it's not always very possible with people really suffering to survive every day. We've got to try and do the best, and we just hope that when we have our next midterm forecast from the Minister of Finance, that he will come up and show us that there is hope for more improved living standards for everybody in South Africa.
Prof, thank you for that. There's so many more questions and answers as well as we look at some of the inequalities and inequities as well. I wanted to perhaps look at some of the current service delivery models and the efficacy to date, and the gaps that also emerge. As we wrap up, can you quickly give us an indication on that front?
Well, look, I can give everybody the assurance that we have some of the best oncologists in the world.
Okay.
We have some of the best treatments available in the world. But please, my take-home message to everybody, whatever is different in your body today than it was last week or last month or last year, please report it, because it must be seen to. An early diagnosis leads to early treatment, and that saves lives.